Dr. Tural, you're a pediatrician, and it must be difficult for moms on an infant, on a newborn baby, and maybe even as the child becomes going to school already, to figure out what's going on with the stomach, the nutrition. I mean, even as adults, we sometimes don't feel so good with our stomach, but we really don't put one and one together and keep doing the wrong thing, basically. Can you give us some advice there and some symptoms which moms should be looking out for, be it the stool, be it whatever it may be, specifically digestion and that type of stuff? Could you shed some light on it?
Well, there's a great debate and also a movement towards healthy eating and nutrition, and then they are trying to implement good nutrition to school-age children. And then, of course, here and there we do come across a child who would need, their individual needs are slightly different than the general population. But for the most part, a child's symptoms of bellyache would, of course, oftentimes come from psychological reasons. They do not want to go to school, therefore that's their excuse of saying that their belly hurts. And then, of course, those instances, that child's belly doesn't hurt on the weekends. And then as soon as they learn that they won't go to school, their bellyache disappear. And then, but the one that is a real bellyache would come with, sometimes it depends on if it is infectious cause or digestive cause. Some of the digestive processes would be causing the symptoms. Like if a child is lactose intolerant and then or lactase deficiency, which leads to lactose intolerance, if they consume a lot of dairy, then they would run out of lactase enzyme, which starts giving them the symptoms that they suffer, which would be like cramping of the stomach and then sometimes diarrhea, and then those symptoms would appear. And so in those instances, parents have to be like careful, and then would be observant to document what the child eats each time, when and then the symptom relationship to what they consume beforehand. And then they would, when they come to the doctor, they would present that information that would be helpful for in the diagnostic workup to determine the cause of the bellyache. And oftentimes the infectious causes of the stomach discomfort or pain would accompany the signs of, say, nausea or vomiting or diarrhea, and some other infections could cause jaundice, yellow color of the skin, and the white of the eye would turn yellow, and the most of those cases would have some decline in the appetite. So those are basically what symptoms you would experience with infectious versus non-infectious causes of the abdominal pain, and then psychological causes of the abdominal pain.
Right. And again, is it advisable for a mom, if she kind of doesn't know, as you mentioned again in another video, it's obviously taking experience to find out the habits and the behavior of the child and what the child reacts to, maybe overreacts to. Would it be nevertheless, for instance, if she calls the doctor and says, my baby does this, does that, and then if she kept track of what the baby was eating, especially if there is a record of like things not going well, then you could ask over the phone already and basically be helpful there. So again, is it because the mom, what is she going to do with all those things? Call the doctor, I guess, right?
Right, exactly. That would be the ultimate resolution of the problem, like a step towards it. Some of the problems, of course, self-resolving, as you were mentioning earlier. If some of the problems do resolve in one day or less than a day, or sometimes in an hour. Self-resolving and not returning problems are problems that you would ignore until it happens again next time. And if it happens again fairly soon, then of course you would want to know the cause of it. And we're talking about some symptoms that are persisting or getting worse, or it's repeating, recurrent symptoms. Those would require the parents to contact the doctor.
Right. And on an average, persisting, we're talking 24 hours, 48 hours. What are we talking usually?
Persisting problem would be days. Persisting problem would be days. Persisting symptom would be probably sometimes it's several hours, because a persistent vomiting is a sort of potentially dangerous symptom that would lead to dehydration and then potential life-threatening situation. So, but a bellyache that is episodic, comes and goes, but persists, like it's sort of waxing and waning, like it is severe and then comes down a little bit, not totally is gone, but it comes back again. The intensity of the pain sort of varies, but it is always there. That kind of pain also you would have to sort of take note of and then act on it.
Right.
Sometimes intensity of the pain increases, sometimes it doesn't increase. Yet you still need to call the doctor if it is persistent.
Okay. All right. Good. So I think we got some idea here. Thank you very much, Dr. Tural.
Thank you.